Welcome back from lunch. And ladies and gentlemen, our next speaker is a true testament to the transformative power of dedication and passion. With a career marked by continuous learning and a commitment to bettering lives of her patients, Corne Van Eck stands as a beacon of excellence in the field of physiotherapy. Corne's journey began with a B Admin in International Relations in 1992, a testament to her diverse skills, but her heart led her in another direction, and in 1996 she achieved a BPhilT degree with top honors from the University of Pretoria, setting the stage for a remarkable career. In 2001, she embarked on a specialized training journey in lymphedema under the guidance of Pierre Summers at the Health South Rehabilitation Institute of Tucson and the Comprehensive Lymphedema Treatment Center. Her passion for improving patient care led her to become a certified orthopedic manual therapist, and she became a full faculty member for Maitland Australian physiotherapy seminars, teaching continued education courses in the United States. Her accomplishments don't stop there. Corne is a board certified as an orthopedic clinical specialist in the United States and holds the distinguished title of a Fellow of the American Academy of Orthopedic Manual Therapy. In 2006, she reached another pinnacle in her career by earning a clinical doctorate of physical therapy degree through a residency program in manual therapy at the Oleg Grimsby Institute in San Diego, California. Currently, she runs her private practice in George, where she continues to impact lives positively. In addition to her clinical work, Corne is also involved in assisting the Axial Spondyloarthritis Association of South Africa in developing awareness strategies, showcasing a commitment to community and well-being. Today, Corne will enlighten us on a topic close to her heart, the importance of exercise. Her profound insights are sure to inspire us to embrace the power of movement for better health and well-being. Ladies and gentlemen, please join me in giving a warm virtual welcome to Corne Van Eck. Over to you, Corne.
Thank you, sir. Like my previous colleague says, I do think I will blush because of that introduction. But let's go ahead and let's turn the camera off and let's share the screen. Okay, so let's start with physiotherapy and the benefits of exercise. So what I will do is I will speak a little bit about physiotherapy, and then I'm going to speak a little bit about the benefits of exercise. Just give me 1 second here. So what we've heard mostly today is that most patients are very frustrated of where to next. So I just want to orientate you as to where does education and physiotherapy and medicine meet. And physiotherapy meets right adjacent to medicine. And physiotherapy isn't just only what most people understand as a good old massage. There's a lot of education that goes into physiotherapy, and then there's a lot of rehabilitation that goes into physiotherapy. So what we will do is I'm going to spend just a few minutes on that part of physiotherapy, as the educational part of physiotherapy, and then we're going to go to exercises, which is also a part of the scope of physiotherapy. So what you've done today by joining these self-help groups and by joining AXPA South Africa, you're actually educating and assisting yourself in the best possible outcome and helping yourself get the best possible outcome. So we've heard many times this morning that there is no lone standing white or hero on a white horse, but we all work together to summit this mountain. And there's many steps and it might seem overwhelming, but let's start with the beginning. So the aim of physiotherapy and the aim of exercises will be the following. It will help with chest wall expansion, will help with preventing deformities, delaying of the progression of the disease, maintaining mobility, decrease pain, sleep and rest better, assist in guidance with activities of daily living, balance and exercise. So when we first discuss hands-on physiotherapy needs to restore. So when we do hands-on therapy and we do restoration of movement, physiotherapists will help you restore two kinds of movements. One we call physiological movements, which is any movement that you do when you like raise your arm up or move your leg. But the other one is accessory movements. And accessory movements is a movement that I'll explain in a minute. So one of the benefits of movement and restoration of movement would be facilitating tissue repair, joint lubrication, muscle inhibition, reproduction of nociceptive activity, reduction of nociceptive activity, reduce intra-articular or peri-articular pressure, and it helps with fear avoidance strategies. So if you hold a cup, then your fingers will flex holding the cup, but it also will rotate. So if you rotate your fingers along and you try to do it yourself, you can't do it. You need one other finger to rotate your, let's say, your middle finger. Those accessory movements we call roll, slide, and spin. And this is something your therapist will help you with. Now, in the spine, that's especially important because the spine is orientated in very specific positions, each vertebra and each regional vertebra. The cervical vertebrae is orientated so that you can rotate, flex, and extend and side bend your neck. So the physio will help you restore that. The thoracic spine is mostly orientated to do rotation, and this lumbar spine to do flexion extension. So you might have been to a physio before and they might have helped you restore these movements and it might look familiar to you. Then the good old soft tissue mobilization, which can also be better understood as mobilization or massage of tissue, and that's to break down scar tissue and adhesions and stimulate new connective tissue formation. The benefits of this tissue mobilization will include reducing the pain, regeneration of soft tissue, increased mobility, improved function, and faster recovery. And you might have been experienced that before. But let's get more to the meat of the things, and that would be patient education. It's important to understand the pain that you have, if it's inflammatory pain or mechanical pain. And this morning we had a very interesting and very sufficient lecture on pain and different kinds of pain. Well, it's really important to understand what different kind of pain you have, because that will help you choose your activities and that will help you guide your exercises that you will get to in just a little bit. One of the main reasons why you want to exercise and why you want to keep moving is to prevent and limit the structural damage and deformities that this disease progression creates. So if we look at this gentleman in 1947, he was upright. And just a few years later, a few decades later, he was completely bent over and stooped over. And this is one of the things that exercising, seeing your physician regularly, seeing your physio, being active in patient advocacy groups, this is something we would like to diminish and then later on prevent all these horrible deformities of this disease. So let's quickly look at an exercise for your posture. So if we go back to this gentleman, you will see that it's completely stooped over, and we refer to that position as flexion. So his hips are in flexion, his spine is in flexion, and his head is in flexion. So to counter that, you can do this right where you're sitting, or you can remember this as something that you can do at the office. So we want you to
Typically
sit
thigh back against the wall.
with your back against the
Upper
wall.
back, shoulders, your back of the head against the wall. Tilt your head down.
Tilt your chin down and hold it there for 10 counts. And that will help straighten the entire spine out. And then you can progress that.
The next exercise, you start in exactly the same way. Both hands against the wall. And you slide up your arms towards above your head, trying to keep your elbows against the wall. Slide up, slide up, slide up as high as you can, keeping your chin tilted.
And that will help in extension. So a lot of us have day jobs and desk jobs, and we sit a lot in a flex position. So this is something nice you can do at the office to straighten out into extension. The physio can also help you with the ergonomic setup of your computer devices, your screen. If you have two screens, the best would be to average 0 by the end of the day. So instead of having one screen right in front of you and the other screen at a 40-degree angle away, or the data that you're entering at a 40-degree angle away, you have both screens at 30 degrees from the midline, left and right in front of you is nothing. So that when you rotate from the left to the right throughout the day, your resultant rotation at the end of the day is neutral. Then it's important for your feet. You can put your feet onto something, put it on, take it off, put it on, take it off. That's motion while you sit. Exercise while you sit. And we know that this is an inflammatory disease, so we know that motion is good for it, as well as your hands. We know that you will have hand and arm pain and numbness and tinglings in your hand by the end of the day if you don't move your hands. So make sure that everything moves throughout the course of the day. Then a little bit of education on how to take care of your back. Since you already have a problem, it's important to do these following back care principles. One is you need to know where's your base of support. Base of support is everything that is touching the floor. Then your center of gravity is from your second lumbar vertebra or your fourth lumbar vertebra, line between the two, that falls right into your base of support. The next important thing to know is moment arm. If you carry something far away from you, the torque that needs to be generated by your spine to keep your nose from hitting the floor is much higher and much more than when you carry something close to you. Then the torque is exponentially halved. So it's very important that you need to remember that a counter force needs to be generated for whatever you're picking up. So carry whatever you're picking up and whatever you're carrying as close as possible to your body. When you vacuum or mop the floor, make sure that your contact is a point. So where you hold the vacuum is in your base of support. Step into the refrigerator. Put your knee on the bed, because then the bed or the car or whatever surface you're touching becomes part of your base of support. And then the center line of gravity will fall in the base of support, and the torque generated by your back will be decreased. The same with cleaning or washing the bathtub. The same with doing the dishes at the sink. Either open the little door or stand with your thigh against the sink so that the whole entire sink becomes part of your base of support and your line of gravity falls inside that base of support. Loading and unloading the groceries would be the same. Picking something up, it's fine to bend your back. Make sure that whatever you're picking up falls inside your base of support. So position your feet so that it falls inside that base of support. You're welcome to carry anything as long as it falls inside your base of support. Pick it up with a short lever and then carry it as close as possible to your body. When you pull or push something, create a triangle with your legs and make sure that at least something, some part of that furniture or whatever you're pulling or pushing object is inside your base of support, so that you do not have to strain your back. Balance is a very important component of this disease. The reason is, inside every joint, we have mechanoreceptors, and those receptors tells the body in what position the joints are. It's called proprioception. But when you have joint destruction, or when you have ligament destruction, then the input to the brain is decreased, and towards as this disease develops, your balance starts being affected, and then you have the risk of falling, and then the falling in itself will bring a whole bunch of problems. So something that you can do, the physio can help you, or you can do it yourself, is to have one leg on the floor and the other leg touches different hours on a clock. So you can go from 9 o'clock. If you stand with your right leg on 12 o'clock, your left leg can touch 9 o'clock, touch 10 o'clock, 11, 12, 1, 2, 3, and then as far back as you can, and see if you can go all the way around like the dial on a face of a clock, and then you swap legs. Another thing you can do in the gym is to use the bozo ball on both sides, both the blue and the flat side, and your physio or your Pilates instructor or your biokineticist will help you with these exercises. And then this is something you can do quickly, watching the screen and just doing this with us as we do it. This exercise, we will have you move your head. It is important to include head movement when you do balance training or balance exercises. The reason is your eyes are a big input of proprioception into your brain. And when you, let's say, talk to a friend and you walk down the street and you turn to the left, you might stumble more easily than if you were looking right in front of you or ahead of you. Or you're walking in your house and the kettle boils and you hear the whistle and you turn your head and you fall. The reason is because your eyes are part of your proprioceptive makeup. So when you do these balance exercises, it is very important to do it with eyes open and eyes closed, and to do it with your head turned to the left, eyes open and closed, with your head turned to the right, eyes open and closed. And then you narrow your base, so your feet is completely touching, and it will be far more difficult. Eyes open, eyes closed, head to the left, head to the right. Then you do a stride stance. And that would be a very narrow base, making it very difficult. Eyes open, eyes closed, head to the right, head to the left. You swap legs. The leg that is behind, that's in the back, that's your strong leg. So if you have a very definite weak leg, make sure that you first practice this exercise with a strong leg behind you. And this is a very nice exercise that you can do at the office. So there's bozo exercises that you can do, repeating this in the gym. The same with eyes open, eyes closed, head to the right, head to the left, and your feet in different positions of stability. Another exercise that you can do that's an endurance and balance exercise is to take weight on one leg and just balance like that. It is very important that the leg you're standing on, the weight-bearing leg, becomes as tall as possible. What you are wanting to do is you want to lean over to the side that you're standing on, but that is incorrect. You need to stand up very, very tall on the leg that you're standing on, and you will feel that as a very good endurance and balance exercise that you can do at the office. You can make it more difficult by doing it more dynamic through movement. You only add a step once you have full control of the motion that you are doing. The next chapter of exercises we'll get to is extremely important. That's breathing and chest wall expansion. And the reason is because your thoracic cage is exactly what it says. It is a cage, but it is a cage for your lungs and your heart. It is protective for your lungs and your heart, but it's also restrictive for your lungs and your heart. In ankylosing spondylitis and in AXPAR, it is very easy to have tightness and ankylosis happen in the thoracic spine and then in the junctions between the thoracic spine and the ribs. This is a very complex region of the body and especially of the spine, because each vertebrae has many multiple small little joints. The rib articulates with the vertebrae on its wing, on its body, and with its disc on one side. So it's 3 articulations per rib, per vertebra, per side. So each vertebrae has 6 articulations. So there's many room for problems to happen, for pain to happen, inflammation, as well as ankylosis. So there's a lot of room here for limited chest wall expansion. And that's why breathing is such an important part of exercises. And there you can see that it is truly a cage that hosts the heart and the lungs. And these little joints in the front that you see there, called costosternal and costochondral joints, is where the bone of the rib meets the cartilage that connects it to the chest bone. And that's also areas that can either get inflamed or get stiff and tight, which is adding to those 6 joints per level. It adds 2 joints per level in the front that can also get tight. So you can see that if we could look at the lungs as if the body were transparent, you can see that chest wall expansion is a very, very important part of exercise. And I'll show you in a minute how to do that exercise. Fatigue is another problem that we have in ankylosing spondylitis because of the chronic night pain and waking up in the second half of the night. And this is one of the benefits of exercise. Exercise will help you restore some of the normal hormones that you need for sleep hygiene and for good sleep. And it will help decrease pain. So it will help you with that nocturnal problems of being awake. So it's not just the exercise that will help you sleep better. The physio can also assist you in ergonomic positioning of how to put pillows and how to position your body specifically that will help you sleep better during the night. The other thing the physio can help you with, and that exercise can be very specific towards, is the activities of daily living. And if we look at a house, we can divide it into bathroom activities, getting in and out of a bath. You certainly need leg and arm strength to get in and out of a bathtub. Another reason for exercise. Functional mobility is the walking and just functioning inside your house. Sexual activity is something that a lot of people don't talk about. But if you have a fused lower back as a man, you will have significant problems during sexual activity. And if you have limited hip mobility as a woman, you will have difficulty with sexual activity. So this is something your physio can help you with, and this is something that exercise can help you with stretching and strengthening. Personal care looks easy, but if you can't reach your toes, you can't clean it. And flexibility plays a role there, and I'm going to share some flexibility exercises with you later on. Other important daily activities would be in the kitchen, like preparing food, standing, So the functional activities that exercise will help you with would be household maintenance, movement, your family activities, work, altruistic avocation, and recreation. It is very important that you stay active. So make games, if anything, play with your children, involve your family in your exercise time, and you will get two birds with one stone. Do more of what you like best. Remember, gardening is exercise, cycling is exercise, art is exercise to some extent. So make sure that you do a lot more of what you love, because in that there's an exercise somewhere. So let's focus specifically on a few therapeutic exercises. Very important to remember that you can't just do exercise and you can't just do medicine. Research shows us that exercise alone and medicine alone is both weaker than exercise and medicine combined in the long-term management of AS. So where do we start? Let's start with the benefits of exercise. It gives you a high concentration score. So if you do HIIT, high interval intensity training, or significant cardiovascular exercises, getting the blood flowing across the brain. It helps with flexibility and mobility, cardiovascular health. It improves glycemic control and insulin sensitivity. It's definitely a mood elevator. Decrease your risk of cancer and increase bone mineral density. So it helps with osteoporosis. The musculoskeletal system benefits from exercise because you have increased muscle capillary perfusion. So the blood is literally pumping through your muscles. There's increased strength due to the hypertrophy that happens. Increased endurance, so you will tolerate your day longer and better, and increased bone density. The cardiovascular advantages would be improved contractility of your heart muscle, because it's a muscle. Increase the blood vessel diameter. That has implications for your blood pressure, because your blood pressure will be more normalized. Increase capillary density. So there's more veins and arteries going to specific tissues, meaning that tissue, especially the muscle and the joints, will get more blood. Improved vasodilation. That means that the artery is increasing in its size, in its width, and that has practical implications for your blood pressure. And decrease average blood pressure at rest. So the benefits in summary of exercise is it will relieve pain through movement. It will decrease stiffness, slow down the progression of your disease, improve your immune system. We heard this morning about our immune systems and our gut, so it will improve that. Maintain mobility and flexibility of all joints and muscles. Will help with chest wall expansion, because you need to breathe deeper, and will help your lungs increase the cage that they're stuck in. It will improve your sleep, and it will have a positive psychological effect on you. Another additional benefit is social interaction. So if you want to understand why exercise is helping, think about a flood and all the debris that ended up on the beach. That is all the inflammatory soup and the inflammatory waste in your muscles and in your system because of this inflammatory disorder that you have. But when you move and when you exercise, especially cardiovascular exercise, it's like a flood that the river comes down, or it's high tide, and the water comes and it washes away the debris. So the blood comes and it washes away or dilutes some of the inflammatory soup, and you have a pristine area. There's less inflammatory chemical mechanisms that can cause some of the pain that you're experiencing. So it's always a difficult question of how much can you exercise and to what extent can you exercise. Now remember this traffic light forever. A green light means no pain. So it means go. You can just go. There's no harm, no danger. You can exercise. That's easy. The other easy one is a red light. A red light means sharp, piercing pain. It means stop. There's danger if you continue. That's also actually easy. The very difficult one is the orange light, but that's true for when we drive as well. The orange light is very difficult. The orange light means proceed with caution. So one of three things is going to happen. When you are exercising or moving and it's an orange light, if you continue, it's either going to turn green, you continue. It's either going to turn red and you stop. The most difficult one will be when orange stays orange, but then you follow the basic rule of common sense, and that's to continue with caution. If orange stays orange, then you just continue with caution, but don't stop movement unless it turns red. So exercise dosage is an interesting topic to discuss. And really, the answer is, what is your goal? So if you want to build muscle and bulk up, then this is not the talk for you. Then you need to do very specific weights with very specific repetitions and in very specific positions of the muscle. But if we're speaking about just creating functional activity and creating the benefits, just a little bit of benefits from a little bit of exercise, then dosage isn't that important. Then we want to rather look at what we want to achieve. Instead of wanting to achieve big, bulky muscles, we want to achieve movement until there's loosening up of the tight joints, until there's reduction of pain. And there's no magic number. 10 isn't magic, 5 isn't magic, 100 isn't magic. So do the exercise and do the movement with a weight as low as possible, with repetitions as high as possible. Unless you want to bulk up, but that's not the aim of this talk. The aim of this talk is to help you move more with less weight and not less with more weight. You can do any kind of exercise. If you do complex exercises, or if you are afraid of exercises, or if you're unsure what to do, please sign up with a Pilates instructor, with a biokineticist, or with a physiotherapist, or with a personal trainer, someone that can assist you and help you along the way until you feel more comfortable. You can use different kinds of equipment. You can use TheraBand, that a biokineticist or the physio can introduce you to, and you can we can give you a home exercise program that you can do this at home if you cannot afford to go to a gym or do not have the time to go to a gym. You can also use balls. It is very good to use a Swiss ball. It has many purposes. You can sit on it while you work, and then you can exercise in your breaks at work. So get someone to help you initially to set up a few exercises, and then you can continue on your own at work. So which exercises are the best? And the answer is any exercise that makes you move. Some of us will drown if we swim, and some of us will break a leg if we dance. So just do whatever you feel comfortable with, or whatever you have been doing. And you can also explore and expand your portfolio of exercises into swimming, which moves all joints and is very good for endurance, aerobic exercise, and cardiovascular exercise. You can work out in the gymnasium, you can do Pilates, or you can do specifically core strengthening exercises, where you get very good online guidelines on that. You can cycle and you can run, given that your back is okay with that. You can play tennis, you can do weights, you can dance, you can run. You can skateboard. There's really no limitation in what you can do. The answer is just be active and enjoy it while you do it. So let's quickly look at a few exercises that you can either jolt down or do it while we do it. You don't need to do this exercise lying down. You can do it sitting up too. And that's to just loosen up your shoulder joints first thing in the morning. So your start position with your hands behind your neck, your elbows closer together, and you're stretching it out to the side. And flip-flopping like a little butterfly until you feel your shoulders have loosened up. The next one, you put your hands together and as a start position, and the end position, you want to reach out as high as you can above your head. Another one you can do before you get out of bed in the morning to just loosen up arms and shoulders. Also, do it while you're still in bed to loosen up your hip. You start with your one foot against your other leg, your opposite leg, and you open up as far as you can into a figure of 4. You do a few to the one side and a few to the other side, loosening up those hips before you give your first step in the morning. You can quickly turn onto your tummy. Start with your feet together, end with your feet apart in a W. You can also progress this by crisscrossing over and not stopping together. This is a very good one for the SI joint, which is most of the time stiff in AS. You lie diagonally on the bed. You lift the hip up and then you drop it off to the floor. And you do it on both sides. That mobilizes the SI joint. This is the same exercise we did initially for postural training, that exercise I showed you in sitting against the wall. You want to make sure that you tilt your chin and then push your entire head back into the pillow. And you will experience a pulling feeling in the back between your shoulder blades. And that's exactly what you want to do. Another one you can do before you get out of bed in the morning is to get your neck rotation loosened up and the cervical vertebrae loosened up. You rotate to one side a few times, squeezing your cheekbone into the pillow. And then you do it to the other side. A very nice one to do before you get out of bed or when you're at the office and you feel that you're very sore and very stiff between your shoulder blades. Reach out as far as you can. Reach up as far as you can. If you feel that it pinches your shoulder muscles right there, then you just bend your elbow and you do it with a shorter lever. And you do it to both sides, and you will feel that it's a nice rotation of your thoracic spine and your neck. You can do this at the office, on the floor, or on the bed. It stretches your entire spine, your neck, your thoracic spine, and your lumbar spine. Lying on your side with your leg over the edge of the bed, looking at your hand, rotating in a big circle as far forward and as far backwards as you possibly can. Great one for the office, very great one for the office. So every now and then, get up from your chair, do the following exercise. If that shoulder muscles pinch right there, no problem. You just bend your elbow right there, bend your elbow, and you do it with a short lever. And then you do it to both sides, and it will loosen up that thoracic spine and your lumbar spine. Nice one to mobilize your lower back from 3 o'clock to 9 o'clock in rotation. And you can leave it at the end there to get a little muscular stretch. Pelvic tilt you can do in sitting, lying down, or standing. Imagine you were a little puppy dog and you put your tail, you bring your tail through your pelvis and you want to put your tail on your nose. That's how we do pelvic tilts. A nice muscular and lumbar stretch. Right leg over left leg with right hand behind right knee, left hand behind left knee, and then you cross over left leg over right leg with right hand behind right leg, knee, and left hand behind left knee. Hold it and stretch. Hold it and stretch. Keep it in that position. If your left leg is on top, you rotate over to the right to give the structures on the left some stretch. And if your right leg is on top, you rotate towards the left to stretch the structures on the right. An exercise to mobilize the entire spine, neck up and down. It will also strengthen your neck muscles. And then back up and down. And this is a difficult exercise for someone with Axpa because they tend to be stuck in flexion and this will have a difficult time doing this extension motions. Very, very good exercise to counteract the postural deficits of Axpa and AS. You have got to strengthen your extensors. It's very, very important because your disease will have you end up in flexion. So your anti-gravity muscles, which is your extenders, has a hard time because it's not exercised. So you will have to make a concerted effort to exercise extension. You can do it, if you're weak, you can do it one arm at a time, one leg at a time, or only arms, only leg. You can do it diagonally with diagonal arms and legs, or like in this case, you can do it with all fours. So let's see if we do it diagonally. You can do it repetitively, or you can do it just holding on and sustaining it in mid-air. Nice little coordination exercise, flexion into extension, flexion into extension. Another exercise you can do at the office in sitting. Hold on to your chair, rotate as far as you can to the one side, hold on and pull yourself over, rotate as far as you can to the other side.
Two minutes time check, Corne. Thank you.
Thank you. That's the exercise I showed initially against the wall. You can also do a wall corner stretch, stretching that front part of your shoulders. And this is a very good exercise, grabbing a hold of your legs and your ankles and extending your legs. That will stretch your lower back and your legs. And this is the chest wall expansion I spoke about. You put your hands right next to the bottom part of your ribs, and you inhale, pushing your hands out, and relax. Inhale, pushing your hands out, and it's called diaphragmatic breathing. You want to expand at least 2 centimeters. Okay, and this is what Miranda spoke about initially. The website where you can get the resources of all the exercises we spoke about. And then it's important to remember that you can achieve freedom. Freedom is not unattainable. I just want to quickly show you where to find that. So you're going to put that in your browser, in the address, and you're going to scroll. You're going to get to management and treatment option, managing your AS resources. You're going to scroll down till you get to this picture of Table Mountain in the back. Benefits of exercise. Scroll down, and then you get to these videos that Miranda was speaking about. And it's self-explanatory. It warns you with a disclaimer, and it goes into fine detail of how to